Your Health tonight, an exciting breakthrough technology for treating patients who are considered legally blind.
That's part of our continuing partnership with the Columbus Medical Association. Tonight, welcome back ophthalmologist Dr. Alice Epitropoulos. And let's first things first, who is considered legally blind?
Well, somebody is considered legally blind if their vision is 2200 or worse, which is the big E on the eye chart. There's 15 million people in the world that are considered legally blind. Some of the more common causes of blindness in the United States include glaucoma, which is a chronic buildup of pressure in the eye that causes damage to the optic nerve. There's a retinal stroke that can happen too, which is an artery occlusion. That's considered an eye emergency. And this occurs when the blood flow in the artery is obstructed for one reason or another. Diabetic retinopathy is another common cause for vision loss. And this is usually due to leaky blood vessels, hemorrhage, scar tissue. And it's important to have diabetics get their eyes checked frequently to minimize the vision loss. Trauma is another common cause, especially this time of year when kids are out of school, 4th of July coming up, playing with fireworks. And then vein occlusion is another common cause, which is
what we're here to talk about today. Right. Vein occlusions. I hadn't heard of this before. Explain what it is.
Okay. Vein occlusions, patients usually present with a painless, vision loss in one eye. In the eye, an artery crosses a vein, and then there's a sheath of tissue that surrounds that. And then with age, arteries tend to harden, which can obstruct blood flow to the eye, similar to how a tire can squash a garden hose. And when we do have diminished blood flow to the eye, that causes vision loss.
Now, doctor, what is this new procedure that can try and reverse this?
Up until now, there has been no medical therapy that's been successful in correcting somebody's vision after a vein occlusion. And what's exciting is there is a surgeon here in Columbus that developed a breakthrough treatment to reverse this type of vision loss. And this is an area that we previously thought that we couldn't even touch. They're operating, we've previously been able to operate on blood vessels elsewhere in the body, but this is the first time that anyone has operated on retinal vessels in the eye.
That is exciting.
It's really exciting. These blood vessels are typically about a quarter of a thickness of a human hair. And this new procedure uses a tool to lift the artery away from the vein, releasing the obstruction to reestablish blood flow to the eye.
And this is the procedure that we're looking at right now.
Is it painful, and is there a long recovery time?
The procedure lasts for, it takes about 20 to 30 minutes for the procedure itself, and recovery can take 4 to 8 weeks. It's not uncommon for patients to return to 20/40 or better vision afterwards, which allows them to return back to their daily activities such as reading and driving.
And very quickly, doctor, is there a high risk for this? Or are there some candidates, people that will be better candidates than others?
Yeah. That's a good question. As with any kind of procedure, there are risks, but these patients really don't have a whole lot to lose because they don't have a whole lot of vision to start with. And as we mentioned earlier, there are no other successful treatments to improve vision with this condition. These patients are usually older. They have a history of high blood pressure, elevated cholesterol, hardening of the arteries. And it's just exciting that this technique, which was developed in Columbus, is considered like I said, it's considered a major medical breakthrough and is being accepted by surgeons all over the world.
Wonderful. Thanks, doctor. We appreciate you being here.
Thank you for having me.
There's so much more to what make